My name is Tajudeen Raji. I head the Division of Public Health Institute and Research for the Africa Centers for Disease Control and Prevention. And of course, as we are all aware, Africa CDC is a specialized technical institution of the African Union that is focusing on guaranteeing the health security of the 1.3 billion people on the continent of Africa. As you are all aware, the African Union, Africa CDC of the African Union is an institution that is just 4.5 years old. To be more precise, it was launched in January 2017. And of course, we all know that before the Africa CDC came on board, there are a lot of mechanism and apparatus that is looking at addressing public health issues on the continent of Africa. And of course, we have also seen the ups and the downs of these different mechanism and apparatus. And in order for us to get it right, to be more precise, to make sure that we are better prepared for the next pandemic, because surely COVID-19 is not going to be the last. Just like Ebola was not the last. After Ebola, we're having COVID-19. COVID-19 is not going to be the last, but we don't know what is next, we don't know when, we don't know where. So in order for us to better prepare, Africa CDC felt a very strong need to launch what we call a new public health order, which essentially has 4 key pillars. The first pillar there is to strengthen health institutions. Rather than being disease specific, we are looking at how do we strengthen our health institutions, especially the public health institutions, so that they are better prepared to respond to any pandemic or epidemic, on our continent. And when we say public health institutions, Africa CDC is inclusive. The Africa CDC regional collaborating centers in the 5 African Union regions is also there, and the different national public health institutes across our 55 member states are also part and parcel of this public health apparatus that need to be strengthened. Number 2, as far as the new public health order is concerned, is to make sure that we improve or we establish and improve on local manufacturing capacity for vaccines, for diagnostics, and for therapeutics. So meaning that we want to see a situation whereby we begin to produce our own vaccines ourselves, we begin to produce the different test kits that will allow us to diagnose whatever disease or infectious disease outbreak that come knocking on our continent, and of course to be able to also produce the necessary medicine to address or to manage people that come down with this whatever disease. Then the third piece there, as far as our new public health order is concerned, is about public health workforce development. We know that this is one area where we have a lot of gaps. This is one area where a lot of our member states are struggling. This one area where we feel if we focus on that, it will allow us to better prepare for the next pandemic. And it takes us a step closer towards guaranteeing the health security of 1.3 billion people on the continent. And the last but not the least pillar in there is that of renewed and respected partnership. We know that there has been a lot of arrangement in terms of partnership, collaboration, coordination, and so on and so forth. If the time has come for us, to embark on a partnership that will put African priority at the front of priority, not the one that will put our priority as the last. We're also looking at partnership that will allow our own institutions to take the lead, to coordinate as far as responding to whatever our infectious disease outbreak is concerned. So these are the 4 key pillars as far as our new public health order is concerned, and we believe that if we're able to put this in place, if we're able to get this right, surely this will take us a step closer towards guaranteeing the health security of 1.3 billion people on the continent of Africa.